So today we're going to go through a lot of the basics about lymphedema, as well as kind of what to watch for if you're at risk for lymphedema, what to do if you develop any signs and symptoms, and kind of some things to help reduce your risk of lymphedema. So we're going to start with the really exciting stuff first, which is just talking about the lymphatic system. So your lymphatic system is actually completely separate from your blood system. The lymphatic system is part of your immune system, and its main job is to move fluid throughout your body. And this fluid is always there. And when it gets to the lymph nodes, that's when it gets cleaned and filtered and gets rid of all the bacteria and things that you don't want, and then keeps everything else that we do want. This picture on the screen kind of shows some of the lymphatic system. The little lines in that picture are the vessels. And again, the lymphatic system has all of its own vessels. They aren't shared with the blood system. All those little spots that look like beans or little circles are actually your lymph nodes. There's no set number that everyone has, but 500 to 700 is probably the greatest estimate about how many you have spread throughout your entire body. Now, there are parts of your body where there are kind of clusters of lymph nodes. Those, and you can kind of see them pretty well in the picture, are in your head and neck. You actually have a whole lot in your head and neck, in your armpits, and in your groin, kind of by your hips. So when you sit down, the part where you bend when you sit is about where those are. Now, there are some kind of scattered everywhere else, but those are the big clusters where they're localized the most. And on this one, it talks about the fact that lymphatic fluid is absorbed from the body tissues. So the lymphatic system kind of runs parallel to the blood system. As the blood circulates through, when it gets out to the little capillaries, which are the little vessels out in the arms and legs and things, some of the parts of our blood, like the protein and some of that kind of seeps out of the capillaries. So the lymphatic system picks that back up and moves it. When it gets to the lymph node, that's the real powerhouse as far as filtering, keeping everything that we don't want out of the fluid. Just like everybody is typically familiar with, if you go to the doctor and they suspect you have some kind of an infection, they'll feel around on your neck to see if you have any enlarged lymph nodes. When you have an infection, they can kind of have to work overtime, and then they get enlarged. And that's one of the signs that doctors look for an infection. So the lymph nodes are really the place where most of the work is happening for the lymphatic system. So what is lymphedema? Basically, if there is a part of our body where the lymphatic system, either the vessels or the lymph nodes, get damaged in any way, could be from trauma, it could be from surgery, it could be from radiation, that area just doesn't move the fluid as effectively as it used to. And so it can get kind of backed up and that area gets swollen. The thing that I tell a lot of the people that come to work with me is that you have this fluid in your body all the time. And if you develop lymphedema at some point, it doesn't necessarily mean that all of a sudden you have an excess of fluid in your body. It didn't magically just produce more fluid. I kind of compare it to traffic. If you drive on the same 3-lane highway every day, traffic flows normally. One morning you drive to work and they've taken out 1 lane for construction, and now there's only 2 lanes and the traffic gets backed up. It doesn't mean there's more cars that day. It just means the same cars are now trying to get through 2 lanes instead of 3. So that's what happens if you have like a surgery and they take out some lymph nodes, or you have radiation and it damages part of your lymphatic system. That same fluid that's always there is now being moved through fewer vessels, fewer lymph nodes, so it starts to get backed up. Wherever that happens, and we'll touch on this in a minute, depending on what kind of surgery you've had, where your radiation has been, different parts of your body can be affected. So these are just some picture examples of what we see when someone comes in with lymphedema. Now, these are all fairly significant. Luckily, in the past many years, there is a lot more known about lymphedema, and I feel like patients get to us a lot sooner. So we don't necessarily see it progress to this stage as often. But it shows, the difference between a swollen leg and arm. And then the gentleman on the right side of the screen, he had probably a head and neck cancer. And so that swelling kind of underneath the chin and all throughout the neck, we see that as well. Typically, lymphedema is caused by cancer surgeries or treatments. We're typically seeing those, if it's an arm or leg, on just the side that was affected. So if someone has surgery on one side, it's usually that side. We typically don't see it being symmetrical, like with both legs or both arms, unless there was a different situation going on. So there is such a thing as primary lymphedema, which actually people can be born with just a defect to their lymphatic system. What we deal with more often is what we call secondary lymphedema, which is what we see in a cancer population. What happens is there's some kind of damage or trauma to the lymphatic system, and it causes it to not be able to move that fluid like we discussed. Any kind of surgeries or treatments for cancer like radiation can cause this damage. And so this is what we watch for with the people that we see who've had any kind of cancer treatments. We do frequently refer to people as being at risk for lymphedema. That means that at this point, that person doesn't have any signs or symptoms of lymphedema. There's nothing happening that makes us think that it's actively occurring. However, anytime you've had a damage to your lymphatic system, you technically are at risk for developing lymphedema. And so there's special things that we like to consider and to teach those people to help reduce the risk of the lymphedema developing later on. One thing to know that I get asked a lot is that there's no set way to say this person's going to get lymphedema, this person isn't. The other thing is that it doesn't necessarily start at a certain stage after the surgery or radiation. I've seen people who have swelling immediately after their treatments, and I've had people who it doesn't come on until 5 or 10 or more years later. So it's something that if you're at risk for that, it's always good to know kind of the strategies for reducing your risk and just knowing how to minimize that as much as possible. So some of the risk factors for lymphedema, anytime someone's had radiation and chemo, whatever part of the body was radiated, whether it be the head and neck, the breast, the axilla, any of those areas, you can get damage to the lymphatic system there. So that can cause a risk for lymphedema. People who have complications after any type of surgery, whether it be breast, gynecological, head and neck, if they have complications where maybe they got an infection or they got a seroma, which kind of a pocket of fluid in there, that can increase the risk. Being younger, if your arm is at risk after like breast cancer, if it's your dominant arm, it does increase the risk some. This picture is showing what is referred to as axillary web syndrome or cording. Some women develop this after a mastectomy or surgery for breast cancer, and it kind of feels like a tight cord is pulling down their arm when they move it. And so that can also be one of the risk factors. And then obviously having lymph nodes removed. The risk is going to go up the more lymph nodes you have removed. I know that now doctors are really aware of trying to minimize how many they remove when possible in order to minimize that risk. However, I have heard patients come in and say, oh, well, my doctor said they only took out 1 or 2 lymph nodes, so I should never get lymphedema. And I agree that the risk for that is very, very low. However, there are other factors, like if that same person then goes and has radiation, that's going to kind of compound their risk a little bit. So it's not just about the number of lymph nodes removed. There are other factors as well. So I like to make sure people are aware of that even if you only had 1 or 2 lymph nodes taken out, you can still have a risk of lymphedema depending on the other kind of treatments you've had as well. For actually developing lymphedema, it all depends on where your surgery or treatments were. So if someone has breast surgery, breast cancer, they may end up with swelling in their actual breast. We frequently see women who choose to have a lumpectomy and then radiation, and they will actually end up with lymphedema in their breast. And so that's something that we treat as well. It can also have lymphedema. They can have lymphedema in their arm, their hand, or even in their actual trunk. We get a lot of women kind of in their armpit and just below it, they'll have swelling in there. I have women all the time who say, yeah, when I put my arm down at my side, it just feels like there's something underneath there. So that's a common area that it kind of just pools that fluid in there. If someone has head and neck cancer, they may have swelling in their anywhere in their face. We see a lot of in the cheeks, chin, neck. People can also get internal lymphedema, especially with head and neck cancers. So it's not uncommon for someone to tell me that they feel like it's swollen inside, like maybe when they try to eat foods, feel like they get stuck in there. Now, there are other things that can cause that after head and neck cancer, but sometimes from the outside, they don't look very swollen, but they may have swelling internally in their throat that causes some issues with swallowing and things as well. If someone has surgery or cancer in their abdomen or their pelvis, they can get swelling in their abdomen. They can get swelling of the genitals, their legs, and their feet. And again, all of these possible areas of swelling are all things that we can treat. Lymphedema therapists typically can treat swelling of any body part. The head and neck stuff is more of an advanced training, so not everyone does that, but for the people who've done the training, we basically treat swelling of any body part.